So, sir, if you can, throw us some light on what are some of the lessons learned from some of the international best practices that we can adopt. One is obviously for the India as such, and is there anything that we can also do for the so-called Bharat, if we can say, like Ameera also, mentioned. Is there something that we can learn from?
Well, I think there are a lot of good international examples available to us. Let's have a look at, first of all, Singapore. Okay. Singapore today is spending about 4.2% of its GDP on healthcare, and it's got one of the finest healthcare systems in the world today. So its spend as a percent of GDP is the lowest, but its efficacy is about the highest. US is the highest spend in the world. It's about twice as expensive compared to any other nation on a per capita spend, and yet it's ranked about 45th or 50th in terms of medical outcomes. So, high spend doesn't necessarily mean good quality. I think it's the efficacy of spend. So in Singapore, the public hospitals are as good, if not better, than the private system. So, and I think that's a great place for a country to be in, and I think there's a model in it that we can emulate. Other bits that we need to, I think, learn from the Western nations is their focus on outcomes. So how good is a particular hospital? Today we speak about it anecdotally today. When we speak about, oh, so-and-so doctor is good, so-and-so hospital is good, care is good here, it's not so good here, etc. Based upon experience. Nothing wrong with that, but it lacks a measurement. In the US today, it is mandatory for hospitals to declare their medical outcomes so that patients can make an informed choice. It is today mandatory for doctors to engage the patients in shared decision making. So they'll provide them all the options and say, now based upon your problem, these are the 3-4 options available. This has this benefit, but the cost is so and so, and the patient becomes part of solutioning. I think there is a lot for us to learn from the Western nations, the good practices, whilst at the same time, I think it's important for us to develop an ecosystem which is largely India-centric, because what we can't afford is to get our costs up inexorably high, absolutely. We are certainly asking the government to spend more than 1% of GDP. We're saying they should get up to 2 to 3% of their GDP. I would say that it's more important for them to, first of all, figure out what is the effective spend. I think in our model, like Ameera mentioned, government should be the payer, it should be the regulator. I don't think government is doing a great job of providing services wherever it provides services, forget healthcare. And that's why, even though private healthcare, whether it's a private doctor clinic or big hospitals like ours, whereas it constitutes roughly 35 to 40% of infrastructure, about 70% of the patients nationally come into private sector because they feel that their problems will be sorted out. So there's a lot of learning in it as we go forward, I think.
So, Dr. Jairam, as a solution to this, you did mention about insurance. How do you think, what should be the role, say, of IRDA, or how should the insurance really, pan out in the country? And also, given the challenges, do you think that things like the foreign direct investments in this sector going up, would that affect, and how does it really affect?
Firstly, there is going to be an increasing incidence of NCDs, non-communicable diseases, and this is going to be substantially higher in terms of healthcare costs. This affects rural, urban India, it affects the rich and the poor. And therefore, there is going to be a financial strain on these schemes in the years to come. Measures to enhance capital into such health insurance schemes is very important. And enlarging such schemes to include the entire nation's marginal and below poverty line population is extremely important for us. And I think will go a long way in ensuring that the healthcare spends of this group is taken care of. There are many initiatives I believe that the government can do in this regard. Firstly, it can definitely mandate health insurance for every single employee. Imagine whether it's a domestic servant, an agricultural worker, or whatever, there is health insurance. This could be partly funded by the government, partly by the employer, with due incentives of tax for such spends. This, I believe, would help immensely that segment of Indian society. Insurance companies in India cannot survive if they continue at the current degree of premium. Therefore, there needs to be an increase of earning into health insurance. The IRDA and the government can do a lot to promote, in addition to what I've just stated. More innovative health insurance is the answer. Today, and I strongly endorse the fact that preventive health care is important to contain costs. Which insurance provider really offers preventive health packages of substance? Very few. So innovative packages that are meant to address the health insurance requirement of the ever-growing population of non-communicable diseases, of the elderly, and such segments which are going to rise in the future is important. It is fair to say that the IRDA and the government have looked at it, but I believe that positive steps, and much more rapidly at that, are absolutely essential in this. It is last point that I would like to state is, it is important for us to gain the experience not only of ourselves, but the wrong that insurance has done in other countries. The learning of what not to do in health insurance is as important as learning to say, this is the way forward in this country. And for India, you cannot cut, copy, paste from any other country. You have to develop inherent insurance policies.
So whilst we are, addressing this issue on health financing, we have seen a lot of private equity investments in the industry, about 1.4 billion in 2013, and then across 73, 93 deals in the last 13, 14 years. So given that Ameera, both you and Dr. Manchanda have observed a lot of private equity, investments, diagnostics being the blue-eyed baby, and so I would like, both of you to share your views on whether it is helping the future or, whether it's a challenge.
I think private equity coming to healthcare has definitely brought some significant advantages. We've had people traditionally in healthcare who are medically sound, who are, good doctors, good medical professionals. But for a medical professional also to become a businessman is a jump. And to be able to move to a commercial mindset is also important when you're building a business. But I think, again, generalizing anything is slightly dangerous. There is good private equity, bad private equity. You want to bring in the right partner. Very important that you're agreeing to the right terms. And there's also a negative part of it, which is private equity can also push to build unsustainable businesses. Today, when we look at e-com and we look at the kind of money that's flowing into e-commerce today, there is not a single profitable company out there today in e-commerce because it's a market share goal, right? The objective is just to go out there and get as many, not only eyeballs, but as many instances as possible. And that can happen when you have too much capital. But that depends again on how the company uses the money, what you do with it, that depends on you. But it can bring a lot of advantages to the table. And I think it has had a significant role in transforming healthcare in the last 10 years. I mean, I still remember pathology being, a one-man shop. It was, single pathology laboratories. I mean, even today, 90% is fragmented. But it has had a significant hand in at least some consolidation that's happened.
I personally feel the single biggest change this investment has brought into, especially in diagnostic, is that all of us are forced to look at scale. We are not limited ourselves to one city or two cities. We are actually looking at the whole country. Now, scale gives you quite a few advantages, both for the patients, because as the scale picks up, cost of doing business definitely goes down. Now, you can always pass it on to the patients, and I have seen that our price increases in the last 10 years have not been that much as one would have seen in the past. And that primarily has been achieved because now the volumes have gone up. That is one. Second is, as the scale picks up, not only governance comes on the commercial side, but even also on the quality side. We are able to invest much more on the protocols which are required to do a better quality testing. So I think on balance, it has really helped the industry to scale up in a big way. And then also form some industry associations. If you are 10, 15 large players, you can always come together and do good for the industry. If you are very fragmented, you can't even share your thoughts. And I believe it's a good way to do. Whether it's a best way to finance a business or take bank loan, I guess this depends on the organization, but I think financing is definitely helping us.
The CSR bit has been talked about a lot in the last 1 year, and because of the change in the Companies Act, healthcare is supposedly, supposed to be one of the larger beneficiaries. On ground, I don't know whether that's really happening. It's going to be seen happening. So how do you think will this CSR fund actually be pushed into the health sector, how it needs to be pushed into the health sector? If some, just quick thoughts from all of you all.
I think this legal mandate of spending 2% on CSR, firstly 2% as a quantum is a debatable point, whether it's enough or not enough. But there again, if there is something which has been legally mandated upon me, but I do not wish to do it willingly, you can always see a difference in the quality in which I execute it. There have been instances in the past where several private players have voluntarily, even before this regulation came into force, have been doing quite a bit in terms of healthcare or education, some of the socially relevant sectors which we have in India today. But I feel we have talked a lot about public-private partnership, and this is one very good opportunity through which private players will come to the force and lend a helping hand towards taking healthcare to every part of the country. So we spoke about government being the payer and the private players being the provider. I think that is something which should get an impetus by virtue of this new regulation kicking in.
So I think just to conclude, if we can have, say, a whole healthcare fund by all the players and providers put together, and then so the corporates, when they have to allocate this fund to the health sector, can this be channelized through a proper and a more, more decent manner where they can be assured that this money will go, to the bottom of the pyramid? Maybe that's a thought for all of us. And just I think time constraints. I think we have to take in the last, summary word is that to be able to make this whole healthcare sustainable in the long run, the private and public at some stage will need to come together to a common platform, discuss issues, and then we can take it forward. I'm sure this has been done time and again, but nevertheless, hope is something that will always keep us going.